Disseminated intravascular coagulopathy, DIC, is a complex disorder characterized by widespread activation of the coagulation system, leading to the formation of clots throughout the small blood vessels and, paradoxically, increased bleeding risk due to consumption of clotting factors and platelets. DIC is always secondary to another underlying condition, and its causes include 1. Sepsis, often from bacterial infections, particularly gram-negative bacteria, leading to widespread inflammation and triggering the coagulation cascade. 2. Severe trauma, including extensive tissue injury, burns, or traumatic brain injury. 3. Obstetric complications, such as placental abruption, amniotic fluid embolism, retained dead fetus syndrome, and severe preeclampsia. 4. Malignancies. Certain cancers, particularly acute promyelocytic leukemia, APL, pancreatic and prostate cancer, can be associated with DIC. 5. Severe organ failure, such as liver or kidney failure, where the balance of clotting factors is disturbed. 6. Blood transfusion reactions. Mismatched blood transfusions can lead to hemolysis and trigger DIC. 7. Severe viral infections, such as dengue, Ebola, or hantavirus infections. 8. Vascular disorders. Large aortic aneurysms or giant hemangiomas, Kasabach-Merritt syndrome, can trigger DIC due to the release of procoagulants. In DIC, the underlying cause needs to be treated, as supportive care alone is insufficient without addressing the trigger.
Can it be a complication of autoimmune disease?
Yes, disseminated intravascular coagulation, DIC, can be a complication of certain autoimmune diseases, although it is less common compared to other causes. Autoimmune conditions can trigger DIC through severe inflammation or through direct damage to blood vessels. Examples include 1. Systemic lupus erythematosus, SLE. In cases of severe disease or lupus flare, SLE can cause extensive immune complex deposition in blood vessels, leading to inflammation, endothelial damage, and activation of the coagulation cascade. 2. Systemic vasculitis, diseases like granulomatosis with polyangiitis, Wegener's granulomatosis, or microscopic polyangiitis can lead to inflammation and damage to the vessel walls, potentially triggering DIC. 3. Antiphospholipid syndrome, APS. APS is characterized by a hypercoagulable state due to the presence of antiphospholipid antibodies. While APS itself primarily causes thrombotic events rather than DICC, in severe cases, particularly with catastrophic antiphospholipid syndrome, SAPS, it can lead to widespread clotting and consumption of clotting factors, resembling DIC. 4. Rheumatoid arthritis, RA. In severe, uncontrolled RA, especially if complicated by vasculitis, there can be activation of the coagulation cascade. However, this is a rare presentation. In these cases, managing the underlying autoimmune disease is critical for controlling the coagulation abnormalities.